Hi, everybody. Today we are talking about COVID-19 and coping, specifically in Prince George's County. And we're going to be talking with Dr. Eric Bush, who's the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care, as well as Jasmine Crew, who is the Director of Clinical Services for Hospice of the Chesapeake. So thank you guys for coming and talking with me via Zoom to talk about Prince George's County particularly. So Dr. Bush, I want to start with you to talk about, in Prince George's County, from a medical perspective, what's been happening since COVID-19 started several weeks ago?
Sure. So just want to get a little background on that. So COVID-19 is from a family of coronaviruses, which is a very common virus that often occurs sometimes in waves. And this one, unfortunately, has mutated. So therefore, hence the whole worldwide global pandemic. Globally, over 2.6 million cases at this point in time. In the United States, 820,000 cases of COVID-19, and unfortunately, 45,000 deaths. Within Maryland, there have been 15,000 cases with approximately 600 deaths. And then in Prince George's County, there has been 4,000 cases. And unfortunately, like a lot of other counties that have high population density and where there are barriers to patients and communities receiving care, receiving appropriate nutrition, things that we talk about as social determinants of medicine, Prince George's County is unfortunately the highest affected county within the state of Maryland. One of the things we hope that our audience will get from this today is really just background and education and how we can support Prince George's County. We've had the privilege as a hospice and palliative supportive care organization to be able to serve Prince George's County for many years. And what we want to do is we want to give back to the community. We want to make sure that we're providing you with the tools in order to stay home, to stay safe. And so the first thing that Jasmine and I are going to talk about is who's most at risk here? Why are we focusing on Prince George's County today? And why is that population at risk? So Jasmine, if you'd like to speak a little bit about risk factors and what puts patients in that county, unfortunately, at a higher predisposition towards getting COVID-19.
Sure. So I like to say that just looking at the makeup of Prince George's County, its population, and where we are situated, Prince George's County is densely populated with mass transportation that comes in from Washington, D.C., Virginia. We're kind of connected in this metropolitan area where a lot of people go outside of the county for work and travel in these areas. With that, Prince George's County is the most populated African American county in Maryland. And with that, there are some higher risk factors as it relates to underlying conditions. So those people who are immunocompromised, have underlying conditions such as cancer, diabetes, heart disease, and the conditions like that puts them at a higher risk for underlying conditions related to COVID-19.
So, Jasmine, I'm going to jump in for just a sec. When you say somebody is immunocompromised, I know I've heard that term, but I'm not quite sure what does it actually mean? Like you've referenced a couple of conditions that are related to that, but what happens with that? Either Dr. Bush or Jasmine, if you could.
Sure. So when I say immunocompromised, think of those cancer patients who have a weaker immune system already and fighting off disease, who are maybe receiving treatments.
Got it.
Also those patients who may have lupus and some other autoimmune disorders. Other factors like obesity, diabetes, heart disease can also have an impact when you have COVID-19. And we do see a lot of those underlying conditions in this community.
So that means if someone were to have those conditions already, and then they or get the coronavirus or COVID-19, that means it could be more significant health issue for them.
Sure.
Okay. All right.
Dr. Bush, do you have any other?
Sure. So no, thank you, Jasmine. Yeah, so just to build on some of the things that Jasmine's talking about, absolutely. Unfortunately, at this time, what's happened because of the inequalities in our healthcare system, because of the lack of access to appropriate medical care, appropriate nutrition, these particular conditions affect African American, Latino communities more. And we know, even just from some of the data coming out from larger metropolitan areas such as Chicago and Detroit, where African Americans make about 30% of the population, unfortunately, they make about 70% of the COVID-19 mortalities. So how can we address this? How can we fix this? So as Jasmine said, if you're immunocompromised, so if you have cancer, if you have things like rheumatoid arthritis, things like lupus, connective tissue disorders, if you have other respiratory issues such as asthma and are on steroids, or chronic obstructive pulmonary disease, congestive heart failure. In addition, if you are of older age, such as someone who's getting there, like myself, not quite there yet, but you know, the older, unfortunately, you are, the higher the mortality risk. We know that folks over 80 years of age, that they are most at risk if they do contract COVID-19. So what can we do to try to help? Number one is hand washing, meticulous hand washing. And again, there's all different ways of going about how long is enough. You want to make sure to wash for at least 20 seconds, whether you sing happy birthday or staying alive or your favorite tune to yourself. Try to make it a little game so that you wash your hands longer. Make sure to get your thumbs and around the wrists, and preferentially all the way up to your elbows if you can, is what I try to do. We know that countries like Singapore that have really focused on meticulous efforts such as hand washing, masking. So when we talk about masking, we talk about face coverings, especially if you're going out anywhere in public, which are now mandatory in Prince George's and a lot of other districts within Maryland itself. Also social distancing. So make sure to stay at least 6 feet away. Even if you do have a face covering, the thing that is deceiving about having face coverings is that sometimes it may give you a false sense of security. Right. It is still very important to maintain that social distancing. And just like the care we provide for hospice and supportive care is at home, really the best place for you to stay is at home. Home is the safest place. We try to make it that way. If you do need to venture out, please make sure to utilize the things that we just mentioned with regards to social distancing, with regards to as soon as you get home, if you're going in an area that you think that you're worried about contacting COVID-19, please, wash your clothes immediately when you get home. Make sure you maintain good overall hygiene, washing, showering, and those are some general tips. Jasmine, do you have anything you'd like to embellish on that?
Yes, I do. I think it's important to state that social distancing also includes distancing yourself from your family. So your extended family and those gatherings. So forego some of those birthday celebrations. I know Easter just passed, and really means that it's not distancing ourselves not just from strangers, but from people we know, and really limiting those gatherings to a small number. Understanding that it's easier to control your circumstance in your home, but every time we invite someone in, we're bringing those things from outside, and that there are people in the community, including our family, who can be COVID positive but not presenting with symptoms and can still pass it from person to person. So the best thing to do is to limit our interactions when possible.
That's hard, but I think that's a really good point. I think I'm talking to a lot of people, like that's been one of the biggest struggles is not being able to be with each other. But that, from what everything I'm seeing scientifically, like that's the best thing. That's the best way to slow the spread, is to really try and contain it, to limit that.
Yeah, Jasmine, you bring up some great points. Jasmine is absolutely correct. It's important to social distance even within your house. And if you have someone within your household who's sick, make sure to appropriately quarantine them as much as possible. It is good to have on hand at home some common things that can be very beneficial given this pandemic, such as hand sanitizers, a thermometer, over-the-counter medications, things such as Tylenol or ibuprofen if it's appropriate, cough medications, things such as Delsum that can really help along those lines. It is good also to have face coverings, and we will, as an organization, be able to provide some face coverings not only to our current patients and their families, but also we are working on, thanks to our volunteers, getting some of those out to the community. There are some great resources out there. The Prince George's County Department of Health has been tremendous in working with us. They have been a great ally in this particular struggle. There are some great online resources, including the Prince George's County Department of Health website. There is also an online CDC self-checker that you can put in your symptoms or your loved one's symptoms, and at least it gives you a good triage point to look at to see, hey, am I at risk? If so, what type of medical care should I seek at this time, and to what degree? So there are some great resources out there. Jasmine, would you like to speak to some of the other resources that you've seen out there that could help the families and communities we serve in Prince George's County?
I'm sure Tammy will share the link, but I do want to speak about an update from Ms. Also Brooks, who connects and speaks specifically to the resources for Prince George's County on how to get food if you need it, how to get those things delivered, connections on how to make your mask at home, and some of the precautions that we're taking. And I also want to say that staying at home slows the spread of the disease, and it's working. So please look out for those resources. Tammy will share the direct links.
Yeah, thanks you guys. Yeah, absolutely. I'll make sure at the end of this video that we have the links listed and the all the resources that you guys mentioned. Anything else that you want to cover regarding coping and the medical aspects of COVID-19 in Prince George's County? I think you guys have talked about a lot of really important and helpful things, but just anything else that we didn't address?
I think we covered a lot of ground in a short amount of time there. Again, we keep you and your loved ones in our thoughts and prayers. We're there to serve the community any way that we can be of benefit. Please let us know. We're there for you. We want to help slow the spread. We want to help you get through this. We will get through this. It's just going to take time and determination to do so.
Yes, I agree.
All right, great. Thanks again. Thanks, Dr. Bush. Thanks, Jasmine.
Thanks.